Nigeria's maternal mortality rate remains one of the highest in the world, with 1,047 deaths per 100,000 live births. The Nigeria Solidarity Support Fund, NSSF, a partnership between the Nigeria Sovereign Investment Authority, NSIA, and Global Citizen, is pushing for inclusive health insurance policies to tackle this crisis. On April 30, 2025, NSSF will host a fireside chat in Abuja to discuss breaking barriers to maternal health equity, the role of health insurance in promoting women's wellness. The event will focus on the barriers to maternal health care, including high out-of-pocket costs and the low insurance enrollment rate, which is at 3 to 5%. It will also emphasize the need for health insurance to cover essential services like cancer screenings, antenatal care, and mental health support. NSSF advocates for solutions such as government-subsidized wellness vouchers for low-income women. This initiative aims to improve healthcare access and reduce Nigeria's maternal mortality rate. Now, joining the conversation at Intertrade Limited, Gwarinpa, Abuja, on April 30, 2025, or virtually, to support a healthier future for women in Nigeria. Thank you for joining us and good afternoon.
Good afternoon. Thanks for having me again on this program.
Well, with Nigeria's maternal mortality rate at 1,047 deaths per 100,000 live births, that is really alarming. And we must say that, I must say kudos for the work you're doing, especially to reduce that alarming figure. But what specific insurance models has NSSF identified that could make the most immediate impact?
Thank you. So yes, that rate is alarming. It's 2023 rates. The last time in 2019, we had rates that were under 8,774, and we were even alarmed then. Now I'm sure because our data processes are getting better, the numbers are increasing, and we can see that we are contributing over 1/3 to the global maternal deaths in the world. So NSSF, being a non-for-profit organization that is focused on addressing pertinent health issues through advocacy and policy development, has identified some health insurance packages that we are going to be proposing tomorrow at our meeting with our different stakeholders. It's important that all the stakeholders, including the policy arm, the development arm, the private sector, come together and address the barriers to maternal health care access, one of them being high out-of-pocket costs, which is as a result of the low penetration of health insurance. In Nigeria right now, we have health insurance coverage of single digits, so less than 10% in the country. And it's even worse for women wellness, covering things like cancer screening, covering family planning, covering things like antenatal care, and also mental health for the women. So we're very strategic in our conversations to say that can we have a package that is focused, a health insurance package that is focused for women's wellness, so that it relieves us of this barrier, reduces this barrier, and we can begin to see improvement in healthcare access for the woman, and also improvements in the ultimate health outcomes of maternal health in Nigeria.
Fantastic. Now, one thing is that your national health insurance coverage stands at just 3 to 5%. What fundamental structural changes need to happen quickly to improve this within the next possibly 2 years?
Okay, one of them from data, because we don't like sharing just opinion. We use data to inform all of our policy push and decision making. And we have gathered data from several parts of Nigeria. One thing that we have realized is a critical challenge with the coverage of health insurance is the awareness. The awareness level for health insurance is still very poor. From our sample, we can see that less than 50% of Nigerians are even aware of that there is a national health insurance scheme or there is a state health insurance scheme that is affordable and that can be, that is reliable, so they can trust and they can get care whenever they are sick and don't have to rely on out-of-pocket payment. So the awareness is very critical, and I feel that that is something that if we tackle within the next 2 years, increasing the awareness of this health insurance scheme. First is that it's available. Second, where they have heard about it. People don't know where to go to register. They don't know what the packages are like. They don't know where to go to even utilize it. So they feel like it's something that even when they register, they may not get access to. So increasing the knowledge base of Nigerians concerning these health insurance packages, increasing the awareness, making it easy for registration, using digital technology to make registration easy and being able to access care easy when you're on the platform is one win that will be a quick win for Nigeria in terms of health insurance coverage. Another quick win will be introducing packages that are attractive. So right now, most people that are even on the healthcare insurance scheme of the National Health Insurance Scheme will say that it's only used for malaria and cold and respiratory infections. They don't believe that it can be used for something that is more life-threatening. And these common illnesses, we know most Nigerians know how to take care of themselves by going to the drugstores. So we need to come up with innovative packages that can cover, screenings and preventive illnesses, which will eventually prevent the burden of care on the government. So if we can prevent more of the cancers, if we can detect them early, if we can prevent total mental unwellness by screening and counseling and psychotherapy, if we can intervene early enough, introducing these packages to cover those innovative and special illnesses, that would reduce the overall healthcare spending on our hospitals, and that will be eventually better in terms of health outcomes for Nigerians.
Now, we're talking about the barriers, especially the shocking ones, when it comes to health insurance and adoption that you discovered through your Ekiti State Awareness Program. Can you talk to us about that?
Yeah. Thank you. Thank you. It's good to come back. So, like we were saying, one of the shocking barriers was really shocking to us was that people don't know where to register. So information, as we think that it may be very a small initiative, a small intervention, is very important. Many people, in fact, the margin between the people that didn't know where to register and the next barrier was a lot. So it's so important that communication be done in a way that is effective for everyone to understand, where do I register for National Health Insurance Scheme or for my state health insurance scheme? If I'm in Ekiti State or any other state, where do I go to register? Right now, there are all sorts of digital tools that we all have on our phones. Why are we not utilizing them to propagate this message of health insurance? The second shocking barrier was that they don't even know what facilities are attached to the National Health Insurance Scheme, whether it's the tertiary hospitals, the teaching hospital, or it's the primary hospitals, or even is the general hospitals. They don't know which ones that, even when I register, where do I go to when I need care? So the major barrier we can see is a lack of communication between us, the health providers or the health leaders, and the people that would benefit from this. And this is very important, that this communication gap is one of the cheapest interventions we should be able to do in health insurance, and we will see the changes, hopefully.
Hopefully you will see those changes. But of course, not everybody is looking at this through rose-colored glasses. You do have some critics who say that wellness vouchers for low-income women would create unsustainable financial dependencies. How do you respond to that?
Okay, so it brings us to innovative financing models. There are several schools of thought on how we can finance health in a sustainable way. Of course, we know that the overall financing of health has to come with our productivity and growth in Nigeria. So we need to do well as a country in terms of our GDP growth. We know that, so that we can carry a lot of these equity goods, because health is equity. It means that it's everybody's right. It's not a privilege. So whether you are poor or you are rich, you should have access to healthcare. It's a social good. It's a development good. It is necessary. It is important. It is everybody's right. So as much as we know that it may not be sustainable, there are ways that we can do it. We can have those health vouchers for certain category of income earners. That's one easy way to do that. Another easy way to do that is to have layered on. So this can be a first step, and then payments can build the next level. So we can have a strategy B, where you can layer on if you need additional services that this particular voucher does not give, so that the very poor at the minimum can get something out of our health insurance. And then health insurance is always a situation of a pooled fund. So the rich subsidizing for the poor, and the healthy subsidizing for the sick. And that is the model that will work. So we have to pool funds. There are several health insurance schemes right now in Nigeria, especially the private sector. We need to begin to say, how do we pool the health insurance scheme together, such that it is a heterogeneous pool that serves everybody, and we're all digging out from one pot. That's another possibility. But like I said, there are several schools of thought of financing, but health must be financed, and we must look for a way to do that.
Well, we must appreciate you for your time on the show this afternoon, Dr. Fejiro Chinye Nwoko, CEO, NSSF. Thank you so much for your time, and congratulations, and continue the job of reducing the rate of maternal mortality in Nigeria.